So this year's Cancer Nursing Conference, EONS 14, is all about towards a new era in cancer care. And that new era is coming now, or is starting now. We know in 2020, the COVID-19 pandemic broke out, and the global pandemic was throwing all of us into uncharted waters in search of a new normal. And we must recognize that cancer nurses and other healthcare professionals all over the world have stretched themselves to their limits to tackle this pandemic. So the ongoing role of cancer nurses had a tremendous important dual role in keeping people with cancer and their families safe from the COVID-19 virus and continue delivering high-quality cancer care from screening, diagnosis, to treatment, into survivorship and end-of-life care. But meanwhile, facing also ongoing challenges to establish a sustainable future cancer nursing workforce, and this by the growing general nurses shortages, the under-recognition of cancer nursing, lack of equal cancer nursing training and education across Europe, and currently more on the forefront, but also enforced by the COVID-19 pandemic, is increased risk of burnout and dropout by high physical and psychological stress. And we know that the future of cancer care will be also influenced by an aging population and an increasing number of patients diagnosed with cancer. And in the EU Beating Cancer Plan, they also said life lost to cancer in the EU are set to increase by more than 24% by 2035, and will make cancer the leading cause of death in the EU. So to tackle these challenges in the future, we need to embrace what we know from the past, combine what we learned from the current, and bring this together, I think, to shape a bright new future in cancer care and create innovative clinical care research, education, leadership, and management in order to provide high-quality cancer care in the new normal. So despite the burden of the global pandemic, it's also forced the cancer nursing community in a positive way to think about new ways to deliver quality cancer care. As prevention needs to be reinforced to turn to growing cancer incidence, cancer treatment options change, and therapies administration is moving from different forms, and care delivering is changing from hospital-based to home-based programs. And this by the cancer pathway and cancer delivery continuously expands from prevention to treatment far into survivorship and end-of-life care. Secondly, the global pandemic also accelerated the use of new technologies and digital healthcare delivery by increased use of e-health platforms, telemedicine, home monitoring, using apps and wearables, and the implementation of altered reality in education programs and much more. So these advancements will need the insight and expertise of cancer nursing to strengthen the implementation and outcome on prevention, on development of clinical trials, access to screening, diagnosis and treatment and decisions, advanced therapy administration, side effects management, and a long-term follow-up based on a set of different patients, disease and care variables. Cancer nurses are experts in delivering of care information, education, management, and care coordination, driven by evidence-based cancer nursing interventions and advanced technical support. So to establish this innovative cancer care delivery in a sustainable way, it is crucial we invest now in the current cancer nursing workforce, but also invest in the upcoming young cancer nursing workforce to reduce the physical and psychological taxing work, providing access to higher levels of education, increased recognition on cancer nursing research and leadership, and including more cancer nursing policymaking as key professionals in the interprofessional approach to achieve the local, national, European, and global goals of cancer control that starts now in bringing equal, accessible, and quality cancer care. And this is reflected in this EONS conference that we saw through all experts that were talking on these high-level topics. So this EONS conference was the beginning of the future of cancer nursing and the global health of cancer care control in Europe and globally. So thank you very much.